This is buccal fat.
And then make sure now go to the audio.
Jawline sculpting.
We need to go to the audio.
Liposuction.
We need to go to the audio.
Sorry.
No, you're okay. Go to USB. Go to audio settings. Let's just test.
Yeah, we're ready.
We're
Yeah,
up.
time's counting down.
We're up. We're good. We're good to go.
Let me make sure I can go.
You're on the beach right now. You're on the beach.
So when I swipe, I have to share the screen now,
You
right?
have to share a screen and then swipe. Yep.
All
And
right.
then we're recording.
It's 12:30. Let's do it.
Oh, wait. Attendees cannot join until you broadcast. Okay, broadcast. This webinar is now broadcasting to all attendees.
Help.
All right, we're gonna give a few minutes here for people to join or whatever they got to do on the Zoom. So the Zoom, get your Zoom faces ready. I don't know if you guys are paying attention to that. Got my Topo Chico and a couple equipment here. I'll show you guys what we're doing. So there's two things I really want to focus on. Obviously, neck liposuction, jawline sculpting. I'm like the jawline sculptor, you know. That's kind of my thing these days. So I think it's important for people to know how, why, and when they can get it done. The recovery, the pre-op process, how everything goes. So in the beginning, you know, I'm getting a ton of questions on Instagram and all these messaging sites about, is it painful? What's the recovery like? So we put together a little compilation, a little video about people just talking about the process immediately after. I think we have a couple post-op days after. And you know, this is what I do, right? 99% of my 90% of my procedures are done in people fully awake, with a little chill pill, but fully awake. So I'm good at it, I promise you. The woman I did yesterday, she had a surgery somewhere else, a BBL, fat transfer somewhere else, and she said it was a horrible process. She didn't think she could do it awake. We made her feel like she was at the beach, you know? So that's what we're doing. I don't know if she's in this testimonial or not, but we'll try to get her, you know, for people to be able to talk to her. I also am happy for people to talk to other patients that have had the surgery with me if you're anxious about it. So that's that. I think at this point, again, we're talking about how it's an enjoyable process, you know, like being at the beach. So we're going to cue the video, couple-minute video here for you guys to see about patients and how they're doing. Am I still going to be here? No, okay. So go ahead, cue the video, and then I'll talk to you after, show you some of my technique and how we would approach things.
Than I expected.
Oh, that's what I'm here.
Yeah, nothing hurts. Literally not taking any pain medications in this
And we
time.
were jamming to good music.
Yeah.
Oh, good, I'm here.
Over, I'm done. So this is it. This is what I look like now.
Piece of cake.
That's what I like. It was so easy, literally. It was like nothing. You just chilled and they did all the hard work. I didn't do
It was easy for me too. We're gonna give her half off because it's too easy. We're supposed to heal remarkably fast, so I mean honestly, within 12 hours, it'll be close to starting to heal. So it'll seal.
Honestly, I've had cavities that were more bothersome than this procedure. So
I see a lot of progress. I like the overall look. It's what I wanted, and it's only 2 months out, so I'm excited to see the rest of the results.
I feel really hot. I love it.
I just personally, internally, have already felt my smile come out so much more because
And
I'm so
the
much more
cheeks are
confident.
coming, man. Like
Yeah.
the cheeks, if you feel them, it feels like there's a golf ball in there right now.
Yeah.
That's about what I took out, and the body comes in and swells. So the cheeks are going across. I never tell people that in about 3 weeks they can really assess it. So like, normally you can start to see it by now, but the best is yet to come. So,
Wait, really?
oh yeah, oh yeah.
Oh, yeah. That's amazing. I love this already.
3 months.
yeah, I definitely noticed like right here all of a sudden.
Thank you, Dr. Kaufman.
There we go. Nice. All right. So I think am I back on here? Yeah, okay, good. So I'll start with how it would go. Normally, you know, nowadays I'm doing so many of these virtual consults. We're able to offer that, and we have a video system all set up so I can do a proper assessment. And if I meet you in person, then we would do a hands-on exam. If not, I do it over the video chat. You come the day of. I have a woman that's waiting right now. I do a little bit of assessment with my hands, obviously. Give some chill pills. That kind of takes the edge off. While that's kind of sitting in, we talk some more. We develop a little bit, more details about the plan. Then we go back to the OR. With the facial assessment, we're determining how we're going to do the sculpting. So neck lipo, jawline lipo is classic. I even have a few of these you know, I had a few devices specially made. So looking out of the corner of my eye, make sure I'm there. Specially made for me. There's the Many Faces of Chicago little symbol there. So I think Dan can see that. Perfect. You know, I have this one. You can see this one's rounded. You know, the shape isn't important for you guys, but for me, it makes a difference, and it allows me to really get people to look thereafter. So I was getting that. So, you know, buccal fat allows for some narrowing here. The neck jawline allows for some narrowing here. If you can saddle that angle of the jaw, if you can get this in and this in, that's what allows for that sharp jawline. So that's, it's really this combo that really is giving people the look thereafter, I think. It's the Chicago, we call it here. But for the lipo, because we'll stick there, I make a little needle poke, about the thickness of this, a little less than this cannula here, behind each ear, after numbing it, and then I'm able to sculpt the jawline, just over the jawline, just behind the jawline, and just under the jawline. And then I also make a little poke at the midline under the chin to be able to sculpt from that kind of midline out. Excuse me, Topo Chico's catching up. So I have Mr. Snatch here, who makes most of my videos. I'll get it up there, no worries. So under here like this. Now, this is important. The facial nerve comes out here, the parotid duct, a little bit deeper, that's more in play with the buccal fat. The facial artery comes right over the mandible here. We have some good videos using cadaver dissection to show this anatomy. But all these things are important, so you really got to be careful with who you're going to for these. So, you know, I know this anatomy well. I'm confident with this anatomy. It's really all I do these days, so it's easy for me to be confident with it. But you check out Instagram, check out Real Stuff, check out our website as far as results go. We got it all out there. A couple good video compilations. So you did the surgery. The details are me. Typically, I make people sit here for about a half hour afterwards because I like to watch them. Sometimes if there's an early bruise starting, I can do things to help that. Then people go home. I normally call them that evening and the following day. And then as far as follow-up, you know, we have people flying in for this procedure. So those people, I do video chat and virtual chat. I'm offering it to even the Chicago people now. And people are taking me up on it, which is, I think, you know, it's maybe a COVID thing, but it's turning into a nice, you know, situation. So we do a couple video chat follow-ups, and then I'd like to for sure see people at the 4 to 6 week mark. And then obviously sometimes the sutures, they're absorbable sutures, but sometimes they stick around longer in certain people, so I'll remove those. And then the results. So the results for buccal fat, I tell people to give me 3 months. You saw in the video there. Oftentimes after a couple of weeks, you start seeing the changes. Neck lipo, similarly, I say 3 months. That one you should start seeing the results for sure in a couple of weeks once the swelling starts to resolve. People can get some dimpling, a little bumpiness of the skin here. So we start a little bit of massage protocol, kind of smooth those out. You know, in the younger population, you know, anywhere from 20 to 38, 39, 40, the lipo alone with my specialized cannula seems to be enough. When you get a little bit older than 40, sometimes the elasticity of the skin is not you know, not quite there as much. So I add this thing called Face Tight or AccuTight, which is tightening the skin from the inside out, just to help, you know, really let this, think a saran wrap with a blow dryer to really suck things around the jaw. So what it is just giving you, you know, something for the skin to drape over kind of tightly. I mean, think about a tablecloth on a nice sharp wooden table. That's what people are after. So, and that allows for the peaks and valleys to create the shadows and curves. So, you know, I say it all the time, but a little bit of a peak here, shadow here, peak here, shadow here. So that's a peak creating the valley, a peak creating the valley. So that's really what people are after. The other thing that I often encourage people to do, or even have a special, I think, where you get a filler now with some of these surgeries, where if you can add a little bit of volume to the chin, push the chin anterior, and pull the angle of the jaw posterior, you can see how like that's giving you that nice sharp look. So whether it be with fillers or threads, I'm doing a lot with threads in the jawline actually, as far as volumizers and biostimulating. So all options to think about, and you know, you have to trust me to make the right recommendations to a certain point, but I do get the patients involved as far as making sure I'm giving them what they want. I will take some questions also, I think, a little bit. I actually have a buccal fat and neck lipo, the patient's numbing, as I said, so we're going to get to that shortly. Maybe maybe we'll post a little something quick on Instagram if you want. But I don't know if you have any questions there directly. I'll just go over some common ones then in the meantime. You know, really, I think the recovery is a big one. The immediate recovery. The buccal fat you can get away with. I mean, I have people that go to work the next day. The neck lipo, you have to wear this wrap. And I like you to wear the wrap for at least 3 to 4 days. Kind of the more is better, to be honest. So I like you to wear it around the clock, more or less. You can take it off for a Zoom meeting or something along those sorts. People feel good. You just look a little goofy for a couple days. And then the head wrap is like a facial corset, essentially, just to kind of, what the key is to push that skin and soft tissue up to have it heal against the platysmal muscle for the neck lipo. The buccal fat, you don't even have to wear the wrap. I recommend it because it decreases the bruising and decreases the swelling. So that's a common one. Antibiotics is another common question. Not indicated to use antibiotics for this procedure. I do typically give them. Just to prevent any infection, particularly if you're doing the buccal fat, because the buccal fat, it's through the mouth, so I can't really sterilize it. We are also COVID testing everybody nowadays. Couple reasons for that. It's safer for the patient. There's some pretty good literature out there that people who have COVID, even if it's asymptomatic, do more poorly during surgery. So at County Hospital, we do a trauma case, somebody might be positive, we have to do it because it's, trauma or a cancer or something. These are elective, so we try to optimize the patients. Then for the staff and for everybody else in the office, knowing if somebody's positive when we're operating inside the mouth is important. So, that's what I have to say about that. I think we're happy to answer any questions directly if you guys submit them through the Instagram or Facebook, or you can direct message the website, and we'll take it from there.